Good morning. My name is Julie Bennington, and I would like to thank the organizers for the opportunity to present to you our work, Chemokine Regenerative Therapy for Cats with Chronic Fibrotic Kidney Disease, as innovative technologies in the pipeline. I am currently a practicing veterinarian at VCA Kaneohe Animal Hospital, but this work was done as part of my dissertation at WFIRM, the Wake Forest Institute for Regenerative Medicine in North Carolina. The work was published in Frontiers in Veterinary Science, Veterinary Regenerative Medicine, dated March 4, 2021, and I would like to acknowledge my co-authors and highlight the affiliations here because they are physicians, scientists, and veterinarians, not only at Wake Forest University, but also in Indonesia, highlighting a global medicine and One Health approach to our work. I was supported by an NIH T32 postdoc fellowship in comparative medicine, and this study was funded by Piedmont Animal Health in Greensboro, North Carolina, now DECRA. This is what I will be discussing today. I will introduce the significance of chronic kidney disease, and then also introduce the chemokine CXCL12 and state our study goal and specific aims. There are two components to this study, a preclinical study conducted at WFIRM and a pilot study in Indonesia in cats with clinical chronic kidney disease, followed by overall conclusions and future direction. Chronic kidney disease has a significant financial impact on our healthcare system in both human and veterinary medicine, with over $50 billion in Medicare spending in patients aged 65 years or older, and 1 to 2 million deaths worldwide, with socioeconomic disparity in prevalence and gap in accessibility to renal replacement therapy. We have a similar clinical picture in our feline patients, as it is one of the most common causes of illness and death in geriatric cats. And we lean on the International Renal Interest Society for staging and guidelines in treatment. The ideal treatment intervention would be one that is readily available, easy to administer, and cost-effective. The common final pathway leading to end-stage renal disease requiring either dialysis or kidney transplantation is chronic renal fibrosis, which is irreversible and has no cure. Our lab investigated the potential regenerative effects on the kidney of the chemokine CXCL12, also called stromal-derived factor 1 alpha. The CXCL12-CXCR4 pathway plays a major role in hematopoiesis, cardiogenesis, neurogenesis, and vessel formation during embryogenesis, as well as stem and progenitor cell mobilization from the bone marrow and adjacent tissues during adulthood. We hypothesize that in chronic renal fibrosis that results from unilateral ischemic reperfusion injury, that a single injection of exogenous CXCL12 would stimulate the upregulation of the expression of CXCL12 to act on these receptors in the adjacent tissue and bone marrow to mobilize stem and progenitor cells to travel along this chemical gradient to the site of injury to inhibit renal fibrosis. And we did this in a preclinical model as well as a pilot study. The injection of exogenous recombinant CXCL12 has been shown to reduce fibrosis in urogenital tract disease. Our goal in this study was to test a regenerative medicine-based treatment for renal fibrosis using an ultrasound-guided technique to administer intrarenal injection of human recombinant chemokine CXCL12 to provide restoration of kidney structure and function in kidney disease patients. Aim 1 was to determine the dose effects of intrarenal CXCL12 injection on renal fibrosis in a cat model of unilateral ischemia reperfusion-induced renal fibrosis, and Aim 2 was to conduct a pilot study in Indonesia examining the safety and feasibility of bilateral intrarenal CXCL12 injection in cats with early clinical kidney disease. This was our preclinical study design and timeline. We had 5 study groups with an N of 6 in each group. We had our control group, injured carrier group, injured low dose, mid dose, and high dose groups. We surgically induced unilateral ischemia reperfusion injury of the left kidney using a technique that was described by Schmidt et al. In 2016. We collected blood and urine samples and did renal ultrasounds at baseline, day 42 and day 70 post-injury, as well as monthly for 4 months post-treatment injection. I just wanted to show you some pictures from gross necropsy of the left kidney in a control cat, an injured cat, and a treated cat, and I think we can all appreciate the difference in color. We analyzed the collagen content of tissues stained with Masson's trichrome stain, which we know the collagen stains blue, for control, carrier, low dose, mid dose, and high dose groups, and quantified the collagen content using cell sense, where the collagen there is yellow. Statistical analysis did show a significant difference among groups, with the mid-dose and high-dose groups having the area of collagen, the total collagen content being significantly lower than the injured carrier group. We also analyzed tissues stained with picoserous red and visualized under polarized light to analyze the birefringent collagen fiber signal. We performed the collagen fiber histomorphometry analysis using software called CT-FIRE to evaluate the collagen fiber width. And we found a significant group effect with the mid-dose and high-dose collagen fiber width being reduced significantly compared to the injured carrier group. Some literature searches show that increased collagen fiber width in the tumor microenvironment is a powerful negative prognostic indicator associated with reduced survival. And this may play a key role in the ability of collagen to remodel. We also quantified the total collagen content in these tissues and found similar changes in collagen content as we found in Masson's trichrome stain. So the results and conclusion from our preclinical study: in the affected kidney, IR resulted in significantly increased collagen content and significantly increased collagen fiber width. Intrarenal injection with mid and high dose CXCL12 significantly reduced kidney collagen and significantly reduced collagen fiber width. Renal function ClinPath endpoints over time detected no significant differences among groups, and this is most likely because this was a unilateral injury model. And we do have still some gaps in knowledge for our future direction. Moving on to our pilot study, we go to Jakarta, Indonesia, which is one of the largest feline exclusive practices. At the time, I was in North Carolina, and this required 24 hours in the air on 3 different planes, one way. That's a lot of air time for 4 trips in 1 year. But I was happy to do it, so I got to work with these wonderful colleagues. WFIRM has a long, rich history of collaboration with scientists and veterinarians and physicians at the Institut Pertanian Bogor Primate Research Center. So here is when we conducted our pilot study in cats with naturally occurring chronic kidney disease to evaluate the safety and feasibility of ultrasound-guided renal injections in private practice. This was our study design. We have inclusion criteria. We wanted older cats. We wanted stage 2 kidney disease, and we needed them to be negative for FELV and FIV. We quickly discovered that FIV is endemic in Indonesia. We administered a single injection into the middle of both kidneys at the mid-renal cortex level, and we had some exclusion criteria. We had 2 study groups with an N of 7 in each group: the control group, no injection, and a treatment injection group. All cats received renal support diet and standard of care treatment. All were given selamectin and praziquantel. I want to point out that in our control group, we did have 1 stage 1 cat, and our treatment group, we had 2 stage 1 cats. We collected blood and urine samples monthly for 1 year and performed renal ultrasounds quarterly for 1 year. Unfortunately, this was around the time of COVID. We had missing data points which precluded statistical analysis. So I just wanted to define that we followed the IRIS guidelines at the time that defined stage 2 kidney disease as creatinine being 1.6 to 2.8, and urine-specific gravity less than 1035. So we have our kidney disease stage definitions. I also want to point out that we have a theoretical stage 0 with urine-specific gravity concentrated greater than 1035 and creatinine less than 1.6. But the summary of kidney disease stage progression showing the number of CATs for each group. In the control group, we had 4 CATs that got worse, 0 no change, and 3 improved. In our treatment group, 0 got worse, 4 had no change, and 3 improved. And those are the breakdowns for those groups. And this is your eye chart for the day. But I am going to take a closer look. This is just the descriptive statistics. Again, we weren't able to do significant statistical analyses. We're going to look at kidney disease stage, urine-specific gravity, creatinine, and SDMA. So these are just raw data of kidney disease stage for the control group over time on the top and treated CATs on the bottom. Here is a graph of the sum of the change in kidney disease stage. Ideally, we want the kidney disease stage to go down. The treated group are in black. The urine concentration, I have highlighted here in green those CATs that are concentrating the urine to 1035 or higher, control CATs on the top, treated CATs on the bottom. Here is the number of CATs that are able to concentrate their urine to 1035 or above, treated CATs in black. Creatinine, highlighting creatinine that is less than 1.6. Number of CATs with serum creatinine less than 1.6, treated CATs in black. Here also I have shown the average % change in serum creatinine over time of the treated CATs in black. And finally, SDMA, less than 14, again, treated CATs in black, average % change in SDMA over time, treated CATs in black. So pilot study conclusions, recombinant CXCL treatment for CATs with kidney disease was safe and feasible in a general practice setting. No treated CATs advanced to a higher stage of kidney disease, and there were no observed negative effects of treatment. And I think us veterinarians know that when we see a kidney disease cat eating, that's a great sign. Future direction, we're super excited that they're actually conducting pilot studies right now at NC State University, as well as University of Florida. And we have recently added additional sites at Texas A&M, Friendship Hospital in Washington, D.C., and Schwartzman Animal Medical Center in New York City. Overall, conclusions and future direction, we have statistical evidence that injury resulted in significantly more fibrosis than control in injured treated kidneys. So our CAT model of renal fibrosis worked. We have statistical evidence that injury resulted in significantly wider collagen fibers than control in injured treated kidneys. This may be related to prognosis. We have some clinical evidence that CXCL12 was safe and feasible for the potential use in a general practice setting for feline patients, potentially for canine patients, and potentially translational for human patients. So our work has showed that preclinical model, cat model of renal fibrosis, as well as a pilot study in cats, that recombinant CXCL12 is a novel, feasible potential treatment for chronic renal fibrosis capable of widespread clinical use, and shows an example of global medicine and a One Health approach to kidney disease. Thank you.
All right. So, one question. Yes, Chris? And Lokmani, you can go set up.
Thanks so much. I was just wondering if you had any sort of idea about the future in using this sort of treatment as a prevention rather than a treatment.
That's a great question. Actually, because I'm a practicing veterinarian, this is very important to me. Early disease detection is really important to me. So this treatment is geared for early kidney disease. So stage 2, you're really not seeing anything in your patients yet. So I think that the ideal patient would be a stage 2 early kidney disease cat.
Thank you so much.